So there are two main clinical manifestations of malaria. You have complicated malaria and uncomplicated malaria. Complicated malaria tends to be caused by P. falciparum because it causes the most severe parasitemia. And 10 to 50% of these result in mortality depending on treatment. It causes abnormal blood metabolism and organ failure. It can also lead to comas, which is called cerebral malaria. Can cause anemia because of hemolysis, acute respiratory syndrome, low blood pressure, kidney issues, and more. On the other hand, there's uncomplicated malaria, which is just the general fever, flu-like symptoms. So you have fever, chills, sweats, headache, nausea, and vomiting and aches. But each species that you're infected with, each species of Plasmodium that you're infected with has slightly different fever, flu symptoms. So you tend to have a cold-hot cycle. So you have that lasts around 6 to 10 hours. So you have a period of cold that lasts for 15 to 60 minutes. You can have a period of hotness, which lasts for 2 to 6 hours, and you can have a period of sweating, which is 2 to 4 hours. And it all depends on each hot and cold depends on the stage of development and maturation of the parasite within the red blood cells. So for T. vivax, it tends to have a 48-hour cycle of peak of heat, drop to cold and sweating, peak, drop for every 48 hours. For P. malaria, you tend to have a 72-hour cycle, and P. falciparum has this irregular cycle.